This video will demonstrate how to effectively and safely clean a telemetry monitor. First, you want to make sure you are using the proper disinfectant for the box. Any patients that are on special isolation precautions or seated precautions, you want to make sure you use dispatch or a hospital-approved bleaching agent instead of the Cavicide wipes. All other cases only require Cavicide. This is a two-step process, which means you will use one Cavicide wipe or as many needed to remove all residue, and then use another fresh Cavicide wipe to clean the monitor again. You want to make sure the batteries are removed first. Then clean the outer perimeter of the box. Avoid cleaning the battery dock unless you see that this area is visibly soiled. This is because the Cavicide wipes are corrosive and will damage the battery dock. Disconnect the cover piece of the battery dock by simply pulling it apart and clean the outer perimeter, as well as the inside area of this piece. Pay close attention to the top perimeter and inner crevices, as debris is often hidden in these areas. You also want to clean along the outer perimeter of the battery dock and then place the cover back on. Additionally, you want to ensure that you clean along the top of the monitor. You can then use the wipe to clean the outer perimeter of the monitor and within the crevices. Pay close attention to these edges, as they often hold debris. Avoid cleaning the metal prongs unless you notice they are visibly soiled. This is again because the Cavi wipes will corrode the prongs, which in turn will cause interferences with the connection. Finally, you want to make sure you go over the monitor one last time to ensure that all debris is removed and the monitor is properly disinfected. This video will demonstrate how to properly clean the telemetry cords, also known as the leads or lead set. First, you want to make sure the cords are untangled. Then take one Cavicide wipe and wipe down each individual cord away from your body. Pay close attention to any lingering residue or debris. Notice how this particular cord has some residue still remaining on the cord. Your next step will then be to wipe around the connection piece of the lead set. Avoid wiping on the inside of this piece of the equipment unless you see that it is visibly soiled. This is because the harshness of the Cavicide wipes can cause essential components to corrode. Now, you are ready to clean the connecting pieces of the chest leads. Start by cleaning the outside of each piece, then fold the Cavicide wipe to fit in between the spaces of the chest leads. Slide the wipe in between these spaces to remove all debris hidden in these areas. You can use the edge of the wipe to gently slide in between the tighter spaces. Next, fold the wipe again in a new section of the wipe and clean in between the grabbers of the chest leads, as debris is often hidden in these areas as well. Sometimes the residue may be a little stubborn, so if you find that you cannot get all of the residue out, you can use a paper clip to help pry out the remaining debris by inserting the paper clip along with the Cavicide wipe and gently pry the debris off. You can repeat this process for each chest lead with the new section of the Cavicide wipe. If your Cavicide wipe becomes too soiled and there are no remaining unused sections, simply grab another Cavicide wipe. Lastly, you want to use a fresh Cavicide wipe to do a final wipe down, ensuring that no residue is left behind. This process is considered a two-step process and aligns with the standards of infection prevention. In addition to cleaning the cords and the connecting piece of the lead set, it is also essential that you give special attention to the SpO2 connecting cord. And there you have it.